For this section, we're going to learn the rest of the muscles on the face that move the eye, the jaw, and the tongue. So we're going to start off with the muscles that move the eye. These are called the extrinsic eye muscles because they're located outside of the eyeball itself. There are also intrinsic muscles that are inside the eye and adjust the lens and the amount of light coming into the eye. We learned those when we did the eye. Now we're going to learn the extrinsic muscles. They all, almost all, originate from a common tendinous ring here at the back of the orbit. And that common tendinous ring surrounds the optic nerve that carries visual information from the eye to the brain. So this angle here is a sagittal section here through the lateral side of the orbit. So we can see the bone that makes the orbit, and then we can see the orbicularis oculi muscle there. The levator palpebris superioris would be deep to that here in the eyelid. And then you can see that we have several muscles that go straight to the eye and then two muscles that take an oblique path. So the ones that go straight are called rectus muscles. Rectus means straight. The fibers go straight. Okay, so they're named for where they are on the eye. So the lateral rectus is on the lateral side, the inferior rectus is on the bottom, and the superior rectus is on the top. Who'd have thunk? So depending on where they insert, they're going to pull that part of the eye back toward this common tendinous ring. So the superior rectus pulls the eye up, the inferior rectus pulls the eye down. The medial rectus is on the other side, the medial side of the eye, and it is going to pull the eye toward the nose. Now we have two oblique muscles. The superior oblique goes on the medial side mostly and the top through a little trochlea. And you remember a trochlea is the word for pulley. So it goes through this little hook on the bone and then inserts on the back of the eye on the lateral side. And it pulls the back of the eye up, so it makes the front of the eye go down. The inferior oblique goes around the bottom of the eye and inserts on the back of the eye and pulls the back of the eye up. So it makes you look, or pulls the back of the eye down so you look up. Okay, so these do their opposite. You can see them from the medial side. Here's the superior oblique there, and here's the inferior oblique there. Okay, so just remember, rectus means straight. The muscles that go straight are rectus. The ones that go at an angle at any point in their path are obliques. Okay, hang on to that terminology. We're going to use it again in some other places. So this is how you can see all of the muscles of the eye. This is what they look like if you take the eyeball away itself. So you can see this path of the superior oblique there, very different from the superior rectus. And then here's the inferior rectus here, and the inferior oblique goes around the bottom like that. Okay? All right, now the next group of muscles we're going to learn are the muscles of mastication. These are superficial. There's a group of superficial and a group of deep ones. The main muscle of mastication, the most important one, is this one called the masseter. It connects the posterior side of the mandible and the angle of the mandible to the zygomatic arch. And it is primarily going to raise and lower the jaw, but it also helps to protract the jaw. So if you contract, especially these front fibers, it'll protract the jaw. The temporalis goes from the superior and inferior temporal lines on the parietal bone and travels deep to the zygomatic arch and inserts on the coronoid process of the mandible. You remember that's that pointy front process of the mandible. So this is going to elevate the mandible and retract it. So these two together are the main muscles that you use for chewing. Okay, the masseter opens the jaw, the temporalis closes the jaw. Now remember, you can also, hang on, before I say that, when you chew, you need to keep your cheeks next to your mouth so that they don't bulge out and get full of food and make it hard to make a bolus so that you can swallow. So this muscle that runs horizontally deep to the masseter This one is called the buccinator. It makes your cheeks not do this. Okay, this is the famous jazz musician Dizzy Gillespie, who people do not appreciate anymore. And he learned to play the trumpet wrong. So he learned to puff out his cheeks playing the trumpet. You're not supposed to do that when you play the trumpet, but he actually had really strong buccinator muscles because, well, that's the way he played the trumpet. But you can actually see his risorius right here making a crease across the buccinator. So the risorius is superficial, the buccinator is deep, okay? And then the masseter goes across both of them, right? So the buccinator compresses the cheek against the teeth, especially when you chew. Now, there's another set of mastication muscles that are deep, very deep, and these are the pterygoid muscles. Ptery means wing. These actually attach not to the wings of the sphenoid bone. Well, they do originate on part of the greater wing, hence pterygoid, but also on the pterygoid plates, which are the little processes that hang down from the sphenoid bone. And these tiny little muscles, the lateral and medial pterygoids, help to move the mandible side to side. You remember there's some horizontal or lateral gliding movement in the mandible. These little pterygoid muscles are the ones that do that. We do not have a model where you can see these muscles, so I will have to use a diagram if I want to ask you about these on a test. All right, now, the next set of muscles are the muscles that move the tongue. We're not going to talk about the muscles that make up the tongue itself. Those are the intrinsic muscles inside the tongue. There are a lot of them, and we are not going to learn them. We are going to learn the extrinsic muscles of the tongue that originate around the oral cavity and insert on the tongue. They are all named for, first, their place of origination, and second, their place of insertion. The insertion is the tongue. Glossus or glossal means tongue, so all of these are called something glossus. So if you see glossus or glossal, that refers to the tongue. So the first one we're going to meet is this genioglossus here, which originates on the mental spines on the mandible. Remember, that's the posterior side of the mandible behind the chin, and it fans out onto the bottom of the tongue. And oddly enough, especially these anterior fibers, when they contract, they actually pull the tongue out of the mouth. So you use them to stick out your tongue. Thank goodness Miley has stopped doing this. So that's the genioglossus, the one you stick out your tongue with. The styloglossus originates on the styloid process, so styloglossus. So this is the styloglossus here. It inserts on the back of the tongue back here. It's going to help to elevate and retract the tongue, especially the back of the tongue. The hyoglossus connects the hyoid bone to the tongue. So it's a wide band of muscles there, okay, from the hyoid to the tongue. There are two of them on either side of the tongue. They're going to depress and retract the tongue, so pull down and back the back of the tongue. And then the palatoglossus, it looks like it's just hanging there in midair. It's not. You remember there's a soft palate there? So the palatoglossus originates on the soft palate at the back of the mouth. There's one on either side, and it pulls the back of the tongue up toward the back of the mouth. Okay, so it elevates the back of the tongue. All of these are antagonists to the genioglossus trying to stick the tongue out. All right, so let's review these muscles we've learned so far. In this one, the man is frowning, so he is using, you know what, I'm going to wait. I'm going to pause. If you want to pause the video, go ahead. Name as many muscles here as you can. Okay, I'm going to start again. All right, he's pulling down with the depressor anguli oris. Now, he might be pulling up a little bit on the mentalis. You can see that lower lip is kind of starting to poke out a little bit, so maybe a little bit of mentalis there. The levator palpebri superioris has been contracted. The orbicularis oculi have been relaxed to open the eye. Here the orbicularis oculi have been contracted. A little bit of contraction of the corrugator supercilii to bring the eyebrows together. Maybe a little of the procerus pulling the nose up. Here we have the zygomaticus major and minor used together. And the orbicularis oculi is a little bit contracted. Here we have the orbicularis oris contracted, creating this Mucci face. The frontalis is creating these horizontal wrinkles in the forehead. And then this is partly the rhizorius pulling us to the side, the depressor anguli oris a little bit as well to pull down on the corner, and the platysma flexing the skin of the neck like that. Okay, so that's what we've learned here. Now, let's look at the other ones that we just learned. This is the masseter, okay? This is the rhizorius here, and deep to it is the buccinator. So those there, that's the buccinator. This is the sternocleidomastoid, which we will meet in the next segment. And this one, oh, this one doesn't have a good temporalis. Well, this is supposed to be the temporalis. It's not. The temporalis goes here. There's another model that has a better one. I have to think about that. What we can't see here are the muscles that control the tongue, but look, on the medial side we can. Here is the genioglossus here, okay? We can't see most of the others. These two here are muscles that connect the hyoid bone to the mandible, and we will learn about them in the next section. And that's the end of our muscles of the head.